First order kinetic means the rate of elimination of drug is proportional to the plasma concentration. For psychological pills, understanding harmful mechanism of medication allows for rapid choice of therapy, fewer medication error, and rapid recognition and reversal of toxic effects. The therapeutic index, certain safety factors, and median lethal dose are various methods of describing the potential toxicity of medications. There are 7 questions to stimulate the application of basic science information to the clinical arena. Case 1. A 12-year-old girl presents to your office with a sore throat and fever. You diagnose her with pharyngitis caused by group A hemolytic streptococcus. She is given IM injection of penicillin. Approximately 5 minutes later, she is found to be in respiratory distress and audibly wheezing. Her skin is mottled and cold. She is tachycardic, rapid heart rate, and her blood pressure has fallen to 70 Hg. Your immediate diagnosing her as having an anaphylactic reaction to the penicillin and give an SC injection of epinephrine. A 12-year-old girl presents to office with a sore throat and fever. Your diagnosis her with pharyngitis and group A hemolytic streptococcus. She is given an IM injection of penicillin. Approximately 5 minutes later, they found respiratory distress and audibly wheezing. So she have bronchial distress. We have to give bronchial dilators, and this after that we have to administer her penicillin, not by intramuscularly, by direct. Her skin is mold and cold. She is tachycardic and her blood pressure has fallen to 70-20 mg. So to increase her heartbeat, we have to give her rapid heart rate. She is have rapid heart rate, so she is tachycardic. We have to lower her heart rate, and to increase the blood pressure, we have to give medications to increase the blood pressures and her reducing her heart rate. For reducing her heart rate, we have to give depressive, and for blood that has fallen to 70-20 mmHg, you immediately diagnosis her as have an anaphylactic reaction to the penicillin and give an SH injection of epinephrine. What effect will epinephrine have affect patient of vascular system? Epinephrine increases the heart rate. Epinephrine is it is a life-saving drug, so it should not be administered. But adrenorespirator primarily mediates the vascular response. Vascular response is certainly with bronchodilators and not adrenoreceptors. Adrenoreceptors helps in producing the production of ADR in what effect will epinephrine have on respiratory system? So effect of epinephrine they have on a respiratory system is that when the epinephrine effect has increased on a respiratory system, she will have cause reduced after increased heartbeat, and she can have a lung collapse because she is having a heavy sore throat pain and lung distress. What effect will epinephrine have on a respiratory system, which adrenoreceptor primarily mediates the respiratory system response? Answer to case 1, autonomic sympathetic nervous system. A 12-year-old girl with strep throat is given an injection of penicillin and develops an acute anaphylactic reaction. Effect of epinephrine on vascular system is vasoconstriction. It reduces the blood flow, so thus the heartbeat will be reduced. So adrenoreceptor, which primarily mediates the vascular response, is alpha 1. Effect of epinephrine on the pulmonary system, bronchial muscles relaxation. Adrenoreceptor, which primarily mediates the pulmonary response. Clinical correlation anaphylaxis is an acute immune-mediated response to allergen characteristic. Adrenoreceptor, which primarily mediates the vascular response, is alpha 1. Alpha 1 is the primary adrenoreceptor which help in the vascular response. What is the effect of epinephrine on pulmonary system? Epinephrine, how bronchial muscles are relaxed in epinephrine, which causes vasoconstriction. Bronchial muscles vasoconstriction, relaxation, adrenoreceptor, which primarily mediates the pulmonary response, beta 2. Clinical correlation. Anaphylaxis is an acute immune-mediated response to an allergen characterized by bronchospasm, wheezing, tachycardia, and hypotension. Epinephrine is the drug of choice used to treat this condition because it appears through the activation of alpha and beta adrenoreceptors to counteract the pathophysiological process underlying anaphylaxis as well as all emergency. The ABC, airway, breathing, circulation should be addressed. So anaphylaxis is an acute and immune-mediated response to the allergen characterized by bronchospasm. So she have bronchospasmic episodes and wheezing and tachycardia, heart rate, hypertension less 70 to by epinephrine is a drug of choice used to treat this condition because she has bronchospasm. Bronchial muscles will be relaxed. Wheezing, she have a wheezing sound because their vaso is constricted. Of breathing, it will open up. Bronchos will relax now, so wheezing will be reduced. Tachycardia will be reduced because breathing is relaxed. Hypotension is when the heart is relaxed, the hypotension relaxed to a normal level. Epinephrine is the drug of choice used to treat this condition because it appears through the activation of alpha and beta adrenoreceptor to counteract the pathophysiological process underlying anaphylaxis. As with all emergencies, the physiological process underlying anaphylaxis, as with all emergencies, the ABC, airway, breathing, circulation should be addressed first. Occasionally, the anaphylaxis causes laryngeal edema to be the extent to that the airway is compromised and intubation. Placement of tube in the trachea is impossible. In this circumstance, an airway emergency airway such as surgical thyroidectomy, creating an opening from the skin through the circoid cartilage is required. Circoid cartilage opening from the skin through the circoid cartilage. So this is circoid cartilage. We will make an opening in the circoid cartilage. Now we will see the image of circoid cartilage because we have seen in many movies that they are piercing such a circoid cartilage with a what you call it, with a big needle. This one, because when we increase the chances of respiration, the patient will survive. see the face. Below that is face. This is sublunar triangle. There is hyoid bone. There is thyroid cartilage. There is circoid cartilage. Sternocleidomastoidus, trapezius, supraclavicular fossa, clavicle, infraclavicular fossa, clavicular head, sternal head of sternocleidomastoidus, and jugular notch. Median thyroid ligament, laryngeal incisor, thyroid cartilage, median sarcothyroid ligament, consus elasticus, circoid cartilage, trachea. So this is the voice box, and it contains a thyrohyoid membrane, median thyrohyoid ligament, and above it is a hyoid bone. This hyoid bone is attached to the lateral thyrohyoid ligament. That is attached to the superior corners of thyroid cartilage. It is the thyroid cartilage that is superior corners. This is laryngeal incision. This shape is laryngeal incision, and this is laryngeal incision where there is an oblique line. Usually that laryngeal incision, you have to take the laryngeal incision, we will take from the oblique line, but there is a chances of loss of sound for patient who are having surgeries across this laryngeal box. Circoid cartilage, there is cartilage is here, and trachea is above that. Lateral near the ligaments of the larynx. Circoid cartilage visible near bottom center. Precursor 4th and 6th pharyngeal arc. So tracheal cartilage, circoid cartilage is in the precursor between 4th and 6th pharyngeal arc. Now we will see the 4th and 6th pharyngeal arc.